Hi, my name is Sarah Slayton, and this is my presentation on the Davis Drug Guide. The purpose of my presentation is to show nurses insight on the Davis Drug Guide. The Davis Drug Guide was the book that we used in nursing school and something that I still use on the floor every day. The purpose of this application is to provide nurses with medication information at the touch of a button. Provides nurses a dosage calculator, trade and generic drug names, clinical safety alerts, warnings, and patient safety information, accurate pill images, and nurses can highlight and make notes within the online application itself. The Davis Drug Guide provides current up-to-date information on medications, including but not limited to drug interactions, pediatric, geriatric, OB, and lactation precautions, IV administration information, risk evaluation and migration strategy, the REMS. The REMS is a drug safety program that the Food and Drug Administration, FDA, requires certain medications with serious safety concerns to help ensure that the benefits of the medication outweigh its risk. The Davis Drug Guide also goes over drug to food, drug to natural product interactions. The red highlighted areas are high alert information or life-threatening side effects of medications. Calculators within the app do body mass index, metric conversions, IV drip rates, dosage per kilograms, and Fahrenheit to Celsius calculations. The utility of the app allows the nurse to educate patient at bedside about medications. If the patient has a new order for Lasix and is being discharged home on it, it allows the nurse to go over information about the medication with the patient. It also has specific patient education section, which can allow patients to understand new and old medications better. In the end, it will improve care since patients can know side effects and adverse reactions of medications and report it accordingly to their primary care doctor. Nurses can easily access the application from a mobile device or computer. As you can tell from the picture, all the information you need is to the side, and if you click on it, it will take you straight to it. Otherwise, you can scroll down and get to the information that way as well. Once you log on to the application, it allows the nurse to easily follow and search for medications. Once you search for a medication and click on it, all the information about the said drug comes up for you to easily see. The results come up fast and it is very easily laid out. The readability of the information is on an elementary level, so if a patient needs to know the information, they will be able to understand it. The ease to learn the information is complicated since it is medications and they do have a lot of information about the said medication, but it is easy to understand and follow. The purchaser is responsible for any damages to the book or computer. There is no privacy issue since no patient information is put into the online version, so no HIPAA laws are broken. Publisher is not responsible for human error or changes to medical science. They do make all the information up to date and correct, but some information could get it put in wrong. Nurses are still encouraged to check the medication information sheet that is within medications themselves. The application has many benefits by giving nurses up-to-date information on medications and treatments. It goes over IV therapy, adverse reactions, side effects, drug interactions, and how much to give based on weight. They do update the medication information as needed, and it does show Canadian medications as well. Limitations to the app, I would say, would be the fact that human error can happen. So as nurses, we still need to make sure that whatever we are doing, we're being safe about it. I would definitely recommend this application since it does have almost every medication on it. It will give nurses insight into medications that they might not give every day. The Davis Drug Guide is a great hands-on tool for nurses. It allows nurses to get up-to-date information on medications as well as necessary information. It allows nurses to educate patients at bedside about new medications and treatments, and which in the end will allow for safer nursing care. Thank you for listening to my presentation on the Davis Drug Guide.